7:05 and the Dr. Payne Show is on the air. What? PinPointHealth.ca, the PinPoint Health Show. That's what we're doing here. The clinics are expanding. There's, I'm going to say 5 right now. Am I close?
You are close.
Look at that.
6, probably 7, 8 soon.
Success, son.
Yeah, it's not. Obviously it's about the success. I'm not going to sit here and say that I don't have aspirations and dreams and all of those things. Yes, absolutely. But I think for anything to be successful, you actually have to have a passion for it. Mm-hmm. And this is a big passion of mine. It's been a passion from the day that I graduated. When I quickly realized, when I graduated, I started practicing on my own. And I quickly realized that if you truly want to help people, in terms of healthcare and pain and injury specifically, you have to have an amazing team because there's so many different types of medical practitioners that deal with pain, whether it's medical doctors, chiropractors, physiotherapists, then going into more alternative things like acupuncturists, massage therapy. There's so many aspects of it that if you actually want to treat it the right way, you have to have this approach. And in fact, most of the world right now is moving towards, when I say the world, I mean the healthcare world, is moving towards a combination of therapies when treating anything, whether that's heart disease or cancer or pain and injury. You often hear that there's things on every end of the spectrum that you can do, whether it's medication, surgeries, all the way to other alternative options. And I'm a big fan of that integrative approach. And I think that's really what works well. And the reason why I'm trying to build the team that I'm building and the community of clinics that I'm building is really because that's the best way to go about treatment of pain and injury. And and even the clinics that we've acquired in the process, the current patients that were there, the new access to care that they're getting within our other clinics is amazing. It works so well to have this multidisciplinary, multimodal approach to care that we can have the input of so many different types of professionals on any one case. And I think that's a tremendous thing.
Info at pinpointhealth.ca, and the number's still the same, though, 1-855-5 Dr. Lou, DRLOU.
And on awesome. That point, so yesterday at around 7:30, I realized something. You know when the weeks go by really quickly, and I noticed I haven't gotten a lot of calls lately. And it seems strange because I typically will get 4 or 5 calls a day that I try to get back to people. And I was like, I can't remember the last time I got it. Just sort of hit me. I've been so busy with so many things that I was like, what's going on? And
you didn't pay your bill.
No, I did pay my bill. We're bankrupt. We're done.
We're done. Have a good day, folks.
No, so we use like this. The 1-855 is through a portaled system, and it typically would go to my phone, which is how I would know that I got these things. So I don't actually sign into the online portal all that often because it typically just goes to my phone. Then when I look through my messages, I was like, the last call I got was August 23rd.
Okay, that's weird.
I was like, that's a long time ago. Sure enough, it wasn't. What happened was the online portal, something happened with the forwarding of the number to me. And so there's like 80 messages now that I have to get back to. So I bring this up to apologize if anybody's listening. If you have not heard from me, it was not me ignoring you. If you haven't heard from my team, it was not us ignoring you. It was that there was an issue with this system. And we've corrected it, and I double checked everything. It took me till like 10 o'clock last night to double check everything to make sure that everything is working. So if you are one of those people that has not heard back from me since August 23rd, which is a very, very long time, I apologize profusely. It was not an intentional thing. It just sort of happened, and we switched some scripting things on the system. And I guess when we did that, something happened. And
at the mercy of technology, my friend.
Nonetheless, so I'm very, very sorry again for anybody listening that this was not intentional. Myself and my office manager are actually going to be making the calls. We've already started trying to get back to everybody like within the next few days. So, again, if you are one of those people, my sincerest apologies.
We'll take a short break, and we'll get into some talk about sports. And the kids are back into the hockey, and I'm watching the media day with the Raptors right now. So that's all coming about, and that leads to busy times in your clinics for sure, my friend. But your phone calls here for the next hour: 416-870-6400 *640 on cell. It's PinPoint Health Show, Global News Radio. Yeah, it is 11:12, PinPoint Health indeed. And now that the phone glitch has been fixed, on the outside of the show, 1-855-55 Dr. Lou, DRLOU, that's all squared away. But for the purpose of the next 45, 50 minutes here, 416-870-6400 *640 on cell. You have health concerns, pain issues. This is the time to call. Claudia, good morning.
Oh, hi, good morning. How are you?
We are fantastic. How are you doing? What's your concern?
I'm calling in regards to, I was just speaking to the other gentleman on the phone a moment ago. My situation is different probably than most patients you've seen.
Okay.
My situation started 2 years ago with a motor vehicle accident, which led to initially acute pain, and from there with different types of treatments such as, massage. I did physiotherapy. I did spinal decompression. I did physio. None seemed to be alleviating the pain. I was on different types of medicine as well, for example, naproxen, and I went from Lyrica to gabapentin. What was suggested to me after about 5-6 months of this pain was that I should get an epidural steroid shot into my back. And unfortunately, the pain clinic that I went to, I had a reaction to it, and I'm actually in the process of going to the United States now to get formally diagnosed, but we believe it's a low level of a condition called arachnoiditis.
Okay.
And I guess my calling into the radio station this morning was just to urge people to be cautious of the adverse side effects that can take place with steroid injections into the spine. Most people are in desperate help because they're in so much pain, and that was my case as well. But had I been told by these pain clinic doctors that there could be adverse side effects and this can alter your health forever, this is a condition that is progressive. And unfortunately,
so 1 second there, Claudia. So number one, I'll start by saying that you started by saying that this is probably very different from what I often see in patients, and actually you're not all that different. I see this type of stuff all the time. The one thing I want to ask you around the car accident, it's low back pain we're talking about?
Yes, low back pain.
And so you mentioned the things you did. How much exercise rehabilitation did you do and continue to do?
Like after, you mean before the injection?
Yeah, like after the accident, like how much exercise was focused on rebuilding your core and strengthening all of the core and gluteal musculature?
Well, I was a very active person prior to this. I was in my mid-40s at the time, but I probably did more than most women did my age. And
No. But so following your accident, how much did you do following your accident? Proper guided exercise rehabilitation with a professional?
Yes, probably about 2 months after the accident. I took it easy for the first few months, and then I started within a few months to start doing physio with someone who was a physiotherapist, but he was also a personal trainer. I found that in some ways it was helping me keep my core strong, but it's just I was in too much pain. I had to stop at one point. So the things that I could normally do in the past, I couldn't even do half of it.
Yeah, so I mean, the biggest thing with these types of mechanical injuries following car accidents is that all of those passive interventions after the acute phase, whether it's someone pushing on you, massage, injections, all of these things, anything where someone does something to you, is the wrong approach in the chronic state. Really, in the chronic stage, it has to be exercise rehabilitation. And what you're describing, hurt versus harm, is an important thing that we educate people on. You can do a lot of things following an accident that could potentially hurt you, but are not necessarily harmful. Whereas when you stop, that doesn't necessarily hurt, but becomes very, very harmful. So exercise rehabilitation following an accident is not something you do for a period of time and stop. You have to go through it. The professional you work with has to modify it so that you can continue going through it. So this is something that I see all the time, and it's done very, very wrong in the industry, where your story, again, is not all that different. People in the acute phase end up going for a lot of passive types of physical interventions. They don't focus heavily on the exercise and rehabilitation of the core, and then they progress because their chronic low back pain doesn't get any better, and so they think that more invasive options like injections are the better option, and there's not very good research for those things actually around these things. Do they play a role in certain instances? Yes, absolutely. So I think your call very much highlights, and again, this is not something that I don't see. I actually see it all too often. It's a mismanagement of how accident patients are dealt with, and the focus following chronic injuries of the low back very much needs to be on exercise rehabilitation and not really the other stuff.
Yes, I agree, doctor.
Yep.
And if I could have a time machine, I would go back.
Yeah, of course,
and make any changes.
But so you don't. The thing is, though, exercise rehabilitation can happen at any point. So if you're not doing it, you should start doing it. And I don't mean just you wake up tomorrow morning and you start doing your own stuff. But if you get the right professional to start with low-level intervention and then grade it over time, this is what we do all the time in the clinic, you can get better. So these things going to the States, decompression, all this stuff, there's, like I'm telling you, what the evidence-based research on low back pain is. You can go anywhere in the world. You can get any procedure you want. It probably will not eliminate that chronic low back pain unless you build up the strength in your core again. And you're not too far past that you can't do that anymore. You can still do that. It's just whether you make the choice to do that or not.
I know, and I have been consistent the last, probably close to a year now, trying to build up my core and my glutes and all the things that were very strong in the past. But with this condition, unfortunately, it has given me an inflation in the arachnoid membrane inside the spinal cord.
That's very different. So that means.
So I went having a terrible accident, which wasn't my fault. So it pretty much shattered everything I was doing at that time, to, like I mentioned before, acute to chronic pain. The injection brought me into a whole other world that I have never seen. So I really urge people to really, really be careful, to really stay away from it. Like you said, doctor.
Well, so I would not. Again, this is because it's my show. I'm going to put out the warnings. I don't say that people should stay away from it, because there are instances where those injections help tremendously. Unfortunately, in your instance, it did not. But, the biggest thing is you're bringing up a great point, which is risk and benefit. And everything you do has a risk and benefit, whether that's something very low level like an exercise all the way to surgery. So it's always about mitigating the risk and increasing the benefit. But that's a discussion between professional and patient, and both people making educated decisions and working as a team. There's so many variables where we can't say, in general, injections are bad for you. They are not bad for you. They are not inherently bad. If used in the right place, the right time, they're actually tremendously helpful. It just sounds like you were in an instance where all of those things didn't line up, and I don't know enough about the case to tell you which thing was misaligned most. But that's the big thing. I appreciate what you're saying, and I think I think the whole audience needs to understand that everything has a risk and a benefit, and it's always about realizing and discussing what those risks and benefits are with the healthcare professional, and then making educated decisions together. That's what evidence-informed care is. It's the best scientific evidence, the clinician experience, and what the patient wants.
Claudia, really appreciate the phone call. You want to reach out further, no problem, 1-855-55-Dr. Lou. That's DRLOU. And for you, the remaining time, lots of it. Bring them on. You got health concerns like Claudia. Good place to start is with a phone call, 416-870-6400, star 640 on your cell. PinPoint Health Show right here on Global News Radio. 1124 PinPoint Health Show, 416-870-6400, star 640 on cell. You want to reach out through email. It is info@pinpointhealth.ca.
Yeah, so, that call we just had, again, is not all that unfamiliar, unfortunately, from what I see all the time, and there's just this big reliance on passive things, right? And the other thing, and I don't fault the patient necessarily for this. A lot of times it's the professionals. The exercise component, the rebuilding of the strength and the endurance of muscles that support things, whether it's your low back or your neck or whatever it may be, is so paramount. And for whatever reason, it's just this little minuscule thing that's sort of talked about. And it's like, we're going to do this, this, and this. And then, we'll give you some exercises. But that point has to be, when I see these patients in my office, I highlight how important that is. And I basically tell them, this is the key to you being better. If you do these things, you're going to do tremendously well. If you don't do these things, you're not going to do well. And I don't make any apologies about it. I don't give them other options. Sometimes it's about also being stern and making people realize. And the reason why I'm stern like that is because I need to get across to the patients that I'm seeing how important that is, and how important it is for them to understand that. So that way, one day, if they don't get better, they can turn around and say, well, I get it. I didn't do the things I was supposed to do. And like Claudia's case, it's never too late to start that. if you're dealing with chronic low back pain, again, the goal is to start building the strength and endurance of the core musculature. That doesn't matter whether you've been in chronic back pain for 2 years or 3 years or 5 or 10 or 20 years, you can still do it. Will it change maybe the expectations on what you should expect and how quickly you should expect results? Yes, absolutely.
It's a grade, right?
We can definitely look at that and start to decipher, okay, well, obviously someone who's been dealing with an issue for 20 years is probably going to take a longer time to feel improvements than someone who's been dealing with it for 2 years. But it doesn't mean at any point it's too late. And in fact, every time you don't start, all you're doing is making it worse and worse and worse. I saw a person this week, throughout her life, 60-year-old female had issues of very, very mild back discomfort, like the regular stuff that I guess we all get. About 3 weeks ago, she, quote unquote, threw out her back. And so I think a lot of us know what that means, like to the point where she couldn't move at all. Right. And she's listened to the show, and she came in and she's like, listen, I've heard you. I've heard what you've said about this stuff. I think I already know what you're going to say to me anyways, but I just want to make sure. And so we went through everything. Sure enough, very much mechanical, nothing, no red flags there. And I basically told her at this point now, she's done a lot of passive intervention to get out of this acute inflammation over the last 3-4 weeks. I said, great, that's awesome that you've done that. Now the transition needs to be towards this stuff. Yeah. And boom, she was all about it. She's like, absolutely, that's why I'm
dedicated
here. Yeah, and that's a big thing when it comes to chronic pain, is willingness on the part of the patient to want to do these things. As soon as you get people that are making the excuses, oh, I can't, I shouldn't, it hurts at this, I can tell you what the prognosis is right off the bat. It's not good. It is not good, because if you don't have it inside of yourself to want to change that, then no one's going to make you change it. You were just talking about someone that you ran into the gym and they were telling you something, and right off the bat they said that they were screwed.
Yeah, first thing they said. I'm like, yeah, probably are with that attitude.
Yeah, with that attitude, 100%, you're screwed. Like, there is nothing anyone can do for that if you don't change that attitude. Now, there are professions like psychologists and social workers. This is why cognitive behavior therapy and psychological intervention is so important for chronic pain. It's around dealing with that aspect of people's perceptions as well, and changing their beliefs and their behaviors around what they're dealing with. And when we were speaking to Claudia, we talked about hurt versus harm, and I want to just dive into that a little bit further. Yeah. So if we take a person that has chronic low back pain, if we get them to start doing some exercises, of course it's going to hurt when they're doing it. That is the point of exercising. If I got you to do 35 bicep curls right now, do you think you'd feel it when you were doing it?
I better.
Absolutely. You're going to feel it. That doesn't necessarily mean that good structured hurt is harmful to the case. Right? But we can get this person and they say, well, I just want to sit down because that doesn't hurt me. Fine, you could sit down, but all you're doing in sitting down is continue to decondition your muscles, become weak, and that creates a harm to your body, because now you just get worse and worse and worse. So in this instance, something doesn't hurt, but is very, very harmful. And I have a million examples for a million different things around this, but it is very, very important for people to understand that when you're undergoing therapy, and especially with exercises will hurt. That doesn't necessarily mean that they are harmful. Now, the professional needs to make sure that they're modifying things so that it's not harmful. So I put this little asterisk there that it shouldn't be. It should not necessarily equal that. But that's a big component of education around chronic pain, is the hurt versus harm. A lot of times there's hurt. One of the things when I see a chronic pain patient that doesn't move around at all, the first thing I ask them is, I need you to start walking 15 minutes a day. And, they'll come back and they'll say, yeah, I can't do it because after I walk, like, my body's all sore, I feel worse, and the next 24 hours is hell. It's like, yeah, but that's what's going to happen. Yep. We need to start conditioning you. If your body is so used to doing nothing and all of a sudden you start doing things, your body breaks down in the process of becoming stronger. It is breaking down and rebuilding itself. And so and anybody that goes to a gym and understands fitness appreciates this. That they understand, yeah, of course, your body has to hurt to break down in order to get better in the future.
If it doesn't get that, you get ticked off, quite frankly.
Yeah, so this is part of it. So it's very, very important that this is educated to the patients and that the patients inherently understand this.
More of that discussion on the way, and plenty of time for your phone calls if you have a point you want to make or a question about your own health. That's why we're here. PinPoint Health Show, 416-870 6,400 star 640 on sale. That's the Pinpoint Health Show right till 12 o'clock on Global News Radio. It is 11:33 on your lovely Saturday morning here. You'll want to reach out when the show's not on. It is 1-855-55-Dr. Lou. That phone number hasn't changed. It's up and running still, so feel free to use that. And info@pinpointhealth.ca through email. You know, you mentioned this. Sorry.
No, I was going to say no calls. Everyone's pissed off at me.
I know. It's not you. Technology, brother.
I haven't got back to them since August 23rd. They're like, screw this guy.
Yeah, no. Do it. He'll get back to you now. The glitch has been fixed.
Yes, it's been realized and fixed.
Yep. You know, you talk about the benefit of learning the exercises, and they'll get some manipulation possibly in one of your clinics, and they'll be all sweetness and light moving forward, and then you get them on an exercise regimen. They don't understand why they have to keep this up and why the pain isn't gone. And I think we used the comparison last week of, you teach your kid how to brush their teeth when they're a couple of years old. It's like, okay, so I just brush my teeth once and I'm done. Yeah. You're done for the rest of your life. Don't bother. You know how to do it now, so no need to brush your teeth every day.
Yeah, it is brushing. So when you're doing these exercise rehabilitative exercises, that's brushing your teeth for your spine. Like that's all it is. You have to upkeep it. But it's the one area that it's so hard to get this across, right? Like even if we deal on the cardiovascular side of things and we said something like diabetes, most people can appreciate that if you're diagnosed with diabetes, you'll have lifestyle things that you have to do. You need to limit the intake of complex carbohydrates and simple carbohydrates in order to keep your blood sugar down, and you have to do this forever. And then you may have to take some medication to help, the insulin receptors and all these things. It's something that is very easily understood, and we get the point of management in those instances, or management with dental stuff. But for whatever reason, when it comes to pain and injury, there's this perception of cure, right? Where these things will go away and never bother you again.
It's a finite amount of time I have this.
No. Yeah, no, it's not. And especially if you've been diagnosed with chronic low back pain, the first component of that is chronic, which means it's been there for a very, very long time, and you now need to do the things. I have chronic spine pain. Does it bother me every single day? No, because I do the right things to manage it.
Chronic exercise.
Yeah, exactly. I continue to work on the core and all of those things in order to build it up, to keep it healthy, and most of the times it doesn't bother me. Does it ever flare up? Yeah, I had a flare up the other day. But I do the right things to manage it, to bring me back down to, I'm sitting here right now. I'm not in any discomfort, but I have chronic spine issues. I've had them since I was 12 or 11 years old, where I herniated a disc when I was very, very young. So I have these things. But if you manage them, you will do incredibly well with it, and you can live your life. And so the question becomes, if we look at case studies, why can there be people like you and I that have these chronic injuries, but yet we are able to live our lives, do the things we want to do? Right. And then you look at other people in other case studies where their whole life has fallen apart and they don't do anything anymore. And that's just a matter of the right management of it. And it's not necessarily that person's fault. Maybe this hasn't been brought to their attention. Maybe they just don't understand it fully. But that's what we're here for. We're trying to educate that these types of things need that type of exercise rehabilitative approach. And if you don't do it, then again, the outcome is very simple. It usually means that you continue living with the chronic ache, and it usually progresses, gets worse and worse and worse. And as it gets worse and worse and worse, each time that it flares up, it's likely more severe, lasts longer, never goes away quite the same. And I see that all the time. People that go through that, they continue to get worse and worse and worse. And then the mental component gets worse and worse and worse. Is brutal. Huge. And these people that have chronic pain will feel every single thing in their body. And they do that because when you are in chronic pain, you often become hyper-focused on anything. You bet. And if you and I sat here right now, John, and we started worrying about every little twinge that we might feel in our body as we sit here, and we amplify it, we'd be in a lot of pain. That's what chronic pain is. It's an amplification of signals that are oftentimes normal. One of the components of chronic pain is that there's potentially an absence of a true physical problem. And we move on to this thing called neuropathic pain, which means that the nerves and the neurology of our bodies have learned this experience. Like missing limb syndrome, or whatever they call it. Like a phantom limb syndrome. Limb exactly. It's a learned syndrome. It's a behavioral thing. And that's why treating the mind is equally as important as treating the body. And when I say treating the mind, that doesn't mean, medicating someone, but it means about changing your beliefs around different types of behaviors, and trying to, component of it is acceptance. That's a huge thing where we see people and they sort of say, like, I can't believe that this happened to me. It's still going on. At a certain point, you have to accept it. I get it. I'm not trying to dismiss it, but I'm just saying that you doing that doesn't help you now. So a lot of the times it's about just accept it, move forward, and move on to the new things. Hurt versus harm education is a very important component of this. Distraction, huge. We just said that people that are hyper-focused, when you're hyper-focused, you're going to feel everything. And oftentimes when I meet these people in my office, I'll often ask them, if you go to like a birthday party or a wedding or whatever, how do you feel? And most of the times these people will say that when they're in some social setting where they're a little distracted, I tend to feel great. But then as soon as I get home...
You're not familiar surrounding.
As soon as I get home, and it's like the only difference is you're not getting home, you're getting back into your mind and you're focusing on your body. Yeah. And when you're doing that, you're going to amplify everything that you feel. You're going to feel much, much worse. You're going to create, people will describe things like fogginess, but of course you'll have brain fogginess if all you're doing is focusing on every single sensation that's in your body. Do you know how complicated our bodies are? Do you know how many different sensations we are taking in at any given second? We're just not paying attention to it because we don't need to. But you can, and if you do, you are going to explode your mind with different types of stimuli and things that are out there in our world.
Because you mentioned, part of the therapy, how important distraction is. I mean, you used a comparison one time. If you come in your elbow, sorry, it's killing me. But if I stamp on your foot, guess what? You're not going to feel for a second. Your elbow.
Yeah.
Right?
Yeah. Yeah. Now, we're not going to go that way.
No, that's generally not part of your clinic's treatment.
Yeah.
But 416-870-6400, star 640 on sale. You have concerns about your health, possibly calling for someone else who doesn't feel a little too bashful to call the radio station. Do that, and we'll get to it in the next 20 minutes. PinPoint Health Show, Global News Radio. It is 11:43, Dr. Payne's show. Still some time for you to call in with your concerns, at least get the ball rolling as far as answers are concerned. 416-870-6400, star 640 on your cell. Afterwards, reaching out, info@pinpointhealth.ca, and the phone line's all fixed up, 1-855-55 Dr. Lou. Tell me a little more about the clinics, too, because I know you're always expanding, and this PinPoint Health thing is new, and it's really cool. You've done some really good work, man.
So PinPoint Health is essentially, right now, I still would say it's a small chain of clinics, primarily in the GTA, focused around pain and injury management with a multimodal approach to that. So we have all different types of professionals, whether that's things like physiotherapists, chiropractors, massage therapists, osteopaths, acupuncture. We deal with things like car accidents, workplace accidents. We have a ton of different modalities, lasers, traction machines, interferential current, shockwave. We have beautiful facilities for exercise rehabilitation, the part that I focus so much on this last bit of the show. We have medical specialists that, like physiatrists and orthopedic surgeons when required. Yep. And, I'm probably missing some stuff. We have all different types of devices when required, custom knee braces if you so need one, orthotics if you require them. So many things, the whole gambit of things that you would need to treat the full extent of pain and injury problems and musculoskeletal injuries. And we're really trying, again, to build a model of care where you are in a place where there's a great team. Now, I'm not saying I've invented this model. These models do exist out there. I think the difference here is the accountability aspect with what I do. I can't think of anyone else in the greater Toronto area that is, a personality on a radio show talking about these things. And again, the accountability aspect, we want to make sure that we're doing the right things. And I think that's an important thing. I think that's something that should really make the public feel safe if you're going to PinPoint Health, that we have this radio show here, that, this is a public forum that anybody can call into. When we see these comments on the screen, what do we usually see? Like 2 words, right? I don't know what people are going to say. So this is a big thing where I know that we need to do an incredibly good job with every single patient, because then otherwise, if you do a bad job, which again, I spend so much time on processes and procedures and, working with my team to really build the right aspects of care. Also, being very, very picky with the people that we hire. is really, really important. And so I think our team is tremendous, and I would encourage anybody out there. Obviously, I'm biased, and you can go anywhere you want. That's the thing about this. It's just look for the red flags. And, if you are looking for a place, then visit pinpointhealth.ca, find a location near you and give us a shot. If you want to see me, just give me a call, 1-855-55-Dr. Lou, DRLOU. That number will also take you to the other clinics, right, if need be. But, we are happy to try to be a part of your healthcare team and give us a shot. And if we can earn the privilege to be part of your healthcare team, I think you'll be very happy with what you find with me and my team at PinPoint Health.
And you've always mentioned, please, if there's something that left a bitter taste or something you're wondering, you got to have that feedback as well.
I would love to know. Yeah 100%. It's so important to have that feedback, that dialogue in a respectful way. Because that's how we grow as a business, as professionals. It's even for the patient care. And when I say this, I even mean it on a low level aspect. So when you treat a patient, and if I was treating you, John, and you really liked me as a person, and you go away, I'm treating your low back, you come back, there's an aspect of you that may not want to tell me that you don't feel that much better, because you really like me as a person. That's even what I mean. I even mean in that interaction with the professionals you're dealing with. Just be honest. Yeah. I would rather you come back, and this isn't a personal thing when we're dealing with these types of things. You're not going to hurt our feelings. This is purely professional, and we need to know that, because it gauges what we're doing, and that way we can know, okay, hang on a sec. Do we maybe have a wrong diagnosis? Are we doing some
treatment?
Yeah, are we doing something? No. Do we have to reassess? Like, are things getting worse? So don't ever feel like you should keep how you're feeling a secret from anyone in your healthcare team, even if it's your family doctor. It doesn't matter, just because you like them as a person. Make sure that you're relaying the right information, because that to us is how we modify our decisions and get you the best care and treatment possible.
And I did that with Adrian when I saw him.
When you were seeing,
his neck is like beyond head. It's killing me. It's killing, but
and Adrian didn't take that personally. He managed it. We then moved to other things to take a look at it, and that's the right way to do it. We need to know the honest truth from patients on how they're doing with their care.
One more little short break, and then we'll get right back into it here. 416-870-6400, star 640 on cell is the number you want to use over the next 10 minutes. You got questions and concerns. PinPoint Health Show, Global News Radio. It is indeed 416-870-6400, star 640 on your cell. Marissa, thank you for hanging on. Good morning.
Good morning. I have a question for Dr. Lou.
Yeah.
Sure.
I had a PRP shot done about 3 weeks ago.
You were one of the calls that I missed.
Yeah, basically.
Yeah, because I heard your message yesterday. Yes, okay, go ahead.
So my pain is still continuing, very bad.
Where did you have this injection?
In both my knees.
No, but from who? Was it someone in my team?
No, from a specialist.
Okay, did you go back and speak to them?
Yes, I did.
And what did they say?
Well, they said it's going to take time, because some people take longer to heal than others, but it's ridiculously crazy how painful it is.
Yeah, I mean, you're asking me to comment on an intervention that someone else did. I can't do that, right? I can't comment on that intervention. What I can tell you, the way I will comment on this, is that PRP for knee osteoarthritis can sometimes take 3 months up to 12 months to have a desired effect. Now, again, if that was something you had done with us, then we can definitely revisit it and assess everything around it. But you had that done with someone else. There's always, again, we were speaking about risk and benefit with any intervention. Anytime you get an injection, there's always a risk to it as well, that it might cause an undesired effect, right? So it might be the puncture that's creating pain. There's a lot of different things, but I can't comment exactly as to what that is in your specific case, because, again, we weren't the people that did that injection for you.
Right.
Okay.
Is there any way can I come and see you as a caller?
Yeah, for sure. I again remember hearing your message last night, and my office manager is going to be calling you anyway. So feel free to come in, see me for an assessment, and then we can comment. We can look at that. But this isn't just towards you, Marissa. I get people all the time that call me saying, I had this done from this person. I don't feel better. Or I feel worse. It's like, I can't comment, right? Like just from a professional due diligence and respect perspective, I can't comment on what someone else did. It's impossible.
Absolutely, I understand. Okay, great. I'll wait for the call.
Yep.
Thank you.
Thanks, Marissa. Appreciate that. Again, 1-855-55 Dr. Lou, DRLOU. The phone issues that you were having, it's just a technical thing. It's all cleared up, so you'll be getting back to everybody.
But I do remember hearing that message specifically and thought that right away because I believe in the message she had mentioned that she had it done somewhere else. So, you know. And
it might have been a perfectly well-executed procedure.
It might not have been, but like... You know, from a certain perspective, you can't really make that my problem and my team's problem, right? If you had something done. Now, I'm happy to assess it and take them on as a patient and then go from there. But it's always and trying to look back, it's always so hard to figure out because in this instance, even if she comes to see me, I'm only hearing one account of what happened. I'm hearing her side. Mm-hmm. I don't know. I don't have the file on the way the injection was done, what injection essentially was used. Was it in a sterile environment, which you would hope it was? Like, there's so many things, right? So it's very hard for me to comment on those things. But in general, in terms of the efficacy of PRP, how well it is to work, can take up to 12 months. Now, I don't think she's necessarily worried about that she doesn't feel better. I think based on her call, she feels worse, right? Which I don't know what happened. You know, a lot of times it's maybe something they did following that. It may have been something with the procedure. Who knows? That's I can't play that game and figure that out, right? That's not my job.
How's the success rate continue with the PRP as far as, it is?
Again, so the success rate for anything when you match it up with the right recipient is always very, very good. And I think that's what we really try to do. And that might be the distinguishing factor of me and PinPoint Health is that we really, really try hard to match up the intervention with the right type of recipient. Because if you can do that, you increase the chances of success by so much. If you just have one tool and you use that one tool for everything that comes in through your door, guess what? Your success isn't probably going to be that good because specific diagnoses require specific interventions and treatments. And we don't work backwards. We don't start at the treatment and then diagnose everyone with a treatment that fits or diagnose everyone with what fits into that treatment. What we do is we're all diagnosticians first. That's what I really try to pride myself on and my team is that we are diagnosticians first. We're clinicians. We figure out a problem. Once we have the problem, we provide the answer to that problem. Even if it's something we don't have, we will then refer out. Because if we don't have it, we're not going to pretend like there's something in our office that's going to be as beneficial for you. What we really need to do is identify a problem. Once we've identified a problem, we can look at what the evidence-based, evidence-informed approach to treating that problem is. If it is something that we have, we will discuss it with the patient. So long as the patient wants to do it, we will then do that intervention. If the patient doesn't want it, we can give alternatives, which may not necessarily have as strong as the efficacy may not be as strong for those things. Right. But again, the biggest thing here is you got to match the treatment with the right diagnosis. And we don't work backwards. We don't have one treatment intervention and everything that we diagnose is going to fit into that. And there's a lot of places out there that have a certain tool and everything that comes in, they modify the diagnosis so it fits into what their treatment is. Not good.
No, not good at all. Not good.
No bueno.
We're gonna leave it there for now. You want to reach out, you know the number by now. Please use it, write it down, keep it in 1-855-55 Dr. Lou, DRLOU. It is info@pinpointhealth.ca. Till next time, the PinPoint Health Show on Global News Radio.